We'd like to get started. We're going to have a reception after, so if people can get seats, then we can continue the lectureship and what promises to be a great evening. So we're looking forward to it. Well, from the sounds of things, this is a speaker who needs no introduction. He's very familiar to our institution, and his name is David Jones, who's this year's distinguished medical alumnus. Dr. Jones is the chief of thoracic surgery at the Memorial Sloan-Kettering Cancer Center, and he was named that this year, 2013. He is also vice chair of quality and safety there, which is a position of great responsibility. He is I didn't know that he was a triple mountaineer, but he got his BA at WVU, he got his medical school training, and he got his residency all at WVU. So he's a son of the Mountain State. He trained in thoracic surgery at UNC, and his first appointment was at the University of Virginia, where he rose to the ranks and became the George Minor Professor of Surgery. He has held important offices throughout American surgery, and he is widely recognized as one of the young stars, and he's established himself already as an investigator and as a scientist and as a clinician. He's Secretary-Treasurer of the Society of Thoracic Surgeons. He's been funded for 14 years with federal grants. His interest is in translational research as far as esophageal and lung metastasis, so it's very important work that he does. He has more than 150 peer-reviewed publications. He's on the study section for the NIH and tumor progression and metastasis. He's been invited lectureships at all the major institutions, including the University of Washington, Columbia, Duke, Cornell, and now returns to West Virginia University as our distinguished alumnus, and this year he'll be giving our Gordon Murray lecture. David, welcome back to Morgantown.
All right, I think I've got all the audio-visual on board. Probably. Can you hear me pretty well? Yeah. Well, it's just wonderful to be back. I really look forward to this. It was an honor to receive the Distinguished Alumnus Award, and then closely followed by an opportunity to come up and give the 6th annual Gordon F. Murray Lectureship to my main mentor throughout my academic career, Dr. Murray. I enjoyed coming down 79 from Pittsburgh. I was telling Rick and Tom Covey that it was nice to see the leaves changing a little bit, and it certainly was a beautiful day to come back home to West Virginia. I thought that I would maybe make some comments about Gordon first, and then talk a little bit about something that is not related to translational research, but it is about clinical medicine, and it is a little bit of medical history, so I think we'll go ahead and get started. No disclosures. So when I think about Dr. Murray and the importance of this lectureship to the institution and certainly to myself, I think back the time I spent as a resident when he was the chair of the department, and he's a superb educator and teacher. I've told him I actually thought that he ran the best teaching conference, which started every week. I think it was Monday, 6:30. It was superb, and I certainly benefited from that. An amazing surgeon, technically gifted, not only in cardiac but also in general thoracic. Was a very strong, staunch resident advocate, and I certainly appreciated that as a resident, and I've appreciated it more as a faculty member. He was instrumental, I think, in building not only the cardiothoracic program at WVU, but he also made significant progress with general surgery as well. And he hired a number of faculty who I benefited from their teaching and education. Many of them are here. Some have gone and moved on. But he built a fine program. And along the way established himself as an international and national leader in cardiothoracic surgery. And really was one of the pioneers in terms of realizing and understanding the importance of curriculum as it relates to the thoracic surgery residency program, and was one of the first, one of a small group of people in 1993 who rolled out that curriculum through his presidency in the Thoracic Surgery Directors Association. And unfortunately, he's a bit of a surgical historian as well, which makes me somewhat nervous about giving this talk, but I'll do the best I can. This is Gordon, I think in 2006, when he won the, or not won, but was awarded the Society of Thoracic Surgery's Distinguished Service Award. And I think service is very much epitomizes Gordon. About 3 years later, in 2009, he ascended to the presidency of the Society of Thoracic Surgeons, which is, for those of you who don't know, the largest group internationally of thoracic surgeons. In going through the files, I found my parting picture with Dr. Murray, Dr. Rabowski, my co-residents in general surgery, Dr. Jenikov and Dr. Sherry Melton, and sitting beside Gordon was Mark Nelson, a good friend of mine and a cardiac surgeon over in the Cumberland area. I showed this picture to one of my colleagues, and she asked me why the residency program director had a boot on her foot, and I think she was probably trying to kick us around a little bit and keep us all organized. And I think things are, Gordon is still active, and I'm sure, I hope you get a chance to talk to him about some exciting work that he's doing as the executive director of the Lung Banks of America, which is a project that's, I think, coming out mainly from Chapel Hill with some important research about identifying lungs, preserving them, and then being able to, frankly, export them and hopefully dramatically increase the number of lung transplants that can be done in the United States. It's important work, and I think it's phenomenal that he's now the executive director. So why do we need to remember kind of who makes, or whose name is attached to surgical instruments? I found as I was using instruments over the years, I didn't perhaps really know who Castroviejo was, or who Kelly was, or where did Babcock fit in, or a Doyen, all of these names that are attached to these instruments. And so I also realized that very few, if any, of my colleagues knew this as well. So I do think it's important as we move into new generations of surgeons, whether you're in thoracic surgery or general surgery, that we have some knowledge and appreciation of that part of our surgical history. So who were these surgeons and what were their inspirations? I can tell you at the outset of this project, I was hoping I would be able to really track down the design process and all of this as well for the various instruments. That was challenging, but I was able to learn a lot more about these surgeons, and in some cases I was able to figure out why they actually designed and have the instruments that bear their name. So I broke this up. We'll talk a little bit about vascular clamps first. You can see a number here that you have. And certainly it would be befitting for the Murray lecture to start with William Halsted, probably the father of American cardiothoracic surgery, a primary contributor to the practice and really the teaching of surgery, was a surgeon innovator, a very good surgeon, a slow surgeon, but very methodical, and he had very, very good results. With respect to cardiothoracic, he had several firsts. He was the first to ligate a subclavian artery aneurysm. He banded at the time when that was thought to be an appropriate methodology and a technique to treat abdominal aortic aneurysms. He did proximal banding. And here you can see with the group at Hopkins, you can see a picture of Dr. Halsted, and I think that's kind of his Department of Surgery faculty at the time. Beside him, you'll talk a little bit later, a few down, is Howard Kelly, and we'll talk a little bit about the Kelly clamp later. Here he is in the famous kind of all-star operation, pictured with Harvey Cushing, and really was a major pioneer in cardiothoracic surgery, and thus was able to develop ultimately the Halsted clamp. Clarence Crafoord was born in Sweden, really is a pioneer of cardiothoracic surgery in Europe. He was a gifted musician, and actually his parents wanted him to pursue a career in music, and he decided against that and went into a career in medicine. Was mentored by Dr. Harold Gertz at the Morby Hospital in Stockholm, and was under the guidance, ultimately became chief of that hospital. He has many firsts, in addition to having a clamp named after him, the Crafoord clamp. But he was the first to perform the Trendelenburg operation in 1927. He realized the limitations of that operation, but still was interested in how to best treat venous thromboembolism disease, and together with several colleagues popularized and moved forward the idea of heparin prophylaxis for deep venous thrombosis. He was one of the first individuals to perform a pneumonectomy for central lung cancers, and did the first surgical correction for aortic coarctation in 1944. This is commonly thought to have happened in the United States at the Mass General, but in fact the paper was reviewed at Mass General first, Dr. Crafoord's paper, and then the first case was done there shortly thereafter. And along with Aki Sinning, who is shown here, Dr. Crafoord at the red circle, Dr. Sinning is off to the left, was involved very heavily in the design and subsequent implantation of pacemakers. This is Dr. Crafoord's doctoral thesis in 1938, where he described 18 pneumonectomies for lung cancer, shown here on the left. And he was an inventor of the spiropulsator ventilator. This actually allowed you to calculate how much volume you were going to deliver the patient, and it could be done in sequence, which was a very important contribution, particularly for those of us interested in thoracic surgery. We all know about DeBakey forceps, the DeBakey clamp. Michael DeBakey was a son of Lebanese immigrants. He was born at Lake Charles in Louisiana and received his undergraduate and medical degrees from Tulane. He didn't go far from home. The legend of DeBakey really began in 1932 when he was a medical student, and at that time devised the roller pump, which would soon be used, or would be used later in cardiothoracic surgery. Following 2 years of surgical residency, DeBakey went on into Europe as an understudy of René Lariche and Martin Kirschner. He subsequently served as a member of the U.S. Army in World War II, and was instrumental in the creation of the MASH units as well as the Veterans Affairs Hospital. He received the Legion of Merit Award and retired at the rank of colonel in 1946, shown here. After the war, DeBakey joined the faculty at Baylor in Houston and did the first repair of an abdominal aortic aneurysm and a carotid endarterectomy in the United States. As you can see here in this picture, he's actually at the sewing machine making his own Dacron grafts, which is what he used as he began to use those grafts in vascular surgery. And he won the Lasker Award in 1963 which I'm able to remember because that's the same year I was born. Another clamp that we use frequently in vascular surgery is the Satinsky clamp. And Victor Satinsky developed an interest in cardiothoracic surgery while caring for wounded in World War II. He was a Russian immigrant, actually born in Philadelphia, first generation, and his parents died at age 6, actually both of his parents, and he was raised by essentially extended family within the Philadelphia area who were also Russian immigrants. During World War II, he actually was a gregarious individual. He ended up, even though he was not Jewish, he was on a troop ship and realized there was no rabbi, and he served as a rabbi on that troop ship for several months, I think until he was found out, actually. He then came back and began to work at Hahnemann in 1946 and stayed there until he retired in 1977. This is a picture of Hahnemann Hospital during that time. He called himself actually the Renaissance doctor. He had many, many outside interests. Most notably was psychiatry. And he developed schools in the Philadelphia area that centered initially on gifted children, but then he realized that there were a lot of children who needed special attention and people with emotional problems, disadvantaged youth, and he was very instrumental in opening many of those programs in Philadelphia. He achieved a black belt in Aikido at age 80 and ultimately died at age 84 from complications related to lymphoma. But he designed the clamp along with many other major medical innovations, over 30, and despite being pictured with an attractive woman there, never married throughout his whole life. Certainly Denton Cooley, along with DeBakey, I would say revolutionized cardiac and vascular surgery, particularly in the United States. And as you know, for many years this team of two worked tirelessly, performing thousands and thousands of operations. Later on, after making contributions to the bypass machines, the treatment of aortic aneurysms, Cooley moved his attention, I would say, more to congenital heart disease and coronary disease. By 1972, he had published he had performed over 10,000 operations. He was an athlete. He trained the same place as Dr. Murray at Johns Hopkins, and was an athletic superstar at the University of Texas. And in fact, the fitness center that serves the community at Hopkins now bears his name. As a surgical resident at Hopkins, Cooley was involved in the first blue baby operation, which is shown here in this photograph, where he was assisting Dr. Blaylock and Vivian Thomas. And I think we're all familiar with that story. E. Stanley Crawford clamp, was born a native of Alabama, attended UAB, was by all accounts an extremely bright individual, graduated Phi Beta Kappa, went to Mass General, AOA, and was really influenced by Churchill to pursue a career in thoracic surgery. Like many of the individuals that I've talked about previously, he served our country as a World War II veteran. He was a mentee of Michael DeBakey and developed many of the surgical techniques that we deal with in terms of managing aortic dissection. And together with his son have published one of the seminal books on the management of aortic dissection. You probably can't see it, but there are two names underneath for this book, and one is his and the other is his son, John. Important for trauma surgeons, he was one of the co-developers of the rapid autologous transfusion device which there are now new iterations of, but that was something that was important in terms of caring for patients with complicated aortic disease. So we'll move on, I think, to some of the vascular instruments and talk a little bit about those. First, we use the Potts clamp not infrequently, or the Potts scissors not infrequently, opening up coronary artery vessels, any number of other vascular anastomoses. Potts grew up working on the family farm. He was very poor. His work there allowed him to subsequently finance his own education. He was very passionate about pediatric surgery. He did his training at the University of Chicago and then moved to the faculty at Rush shortly thereafter, which is where he remained there at Children's Hospital and at Memorial Hospital. He developed the Potts shunt for tetralogy of Fallot and did many of his procedures without request of any fee. And I have to think that probably figures back to his own upbringing and the fact that he had very little money when he grew up. For those who knew Potts, he was a very imposing figure. He was about 6'2". He had very large hands with long fingers, and really out of necessity he developed a number of finer scissors and forceps, which are still used today. And here he is in a picture that was taken at the surgical section of the American Association of Pediatrics, here, third from the left in the back. The Castroviejo, we use those obviously in vascular and cardiac surgery. Castroviejo was an ophthalmologist. His father was an ophthalmologist and was really a staunch supporter throughout his career of basic research. He became a pioneer both in Spain as well as in the United States of advancing the surgical care of eye diseases. He eventually became chief of ophthalmology at St. Vincent Hospital in New York City and later developed and ran his own hospital. He was not the first to perform a successful human corneal transplant, but many of the techniques that were used to do that he had perfected and used in other eye operations. He was much of a showman. He billed himself as the best ophthalmologic surgeon in the country, and many patients traveled to New York City to be cared for him. And this is a photo of him. This is a picture of St. Vincent's at the time, and as I mentioned, he would bring patients to New York City, operate on them, and then they would agree to actually come to conferences, and he would display how successful his surgery had been. As I mentioned, he funded the Castroviejo Institute for Ophthalmologic Research in Madrid, and that institution still stands and still does a lot of important research as it relates to the eye. Thomas Fogarty, Fogarty catheters, probably this is one of the individuals that many may already know. He was born in Cincinnati, Ohio. His father died very early when he was 8 years old. As a teenager, he was very interested in how things work. He took motors apart, put them back together again, was very curious with devices. And during his youth, he probably maybe not having a father, he was a pretty well-respected pugilist and won a number of different Golden Glove boxing awards. At the age of 14, he started to work at the Good Samaritan Hospital in Cincinnati and developed a relationship with Dr. Jack Cranley, who was a vascular surgeon there at the time. And I think that relationship and mentorship, much like a father figure, was very important and figured into ultimately some of what Tom was going to choose to do with his own career. He invented the embolectomy catheter, in fact, as a medical student in 1960. He did his surgical residency at Oregon with Albert Starr. He holds over 63 patents, so he wasn't just a one-hit wonder with the embolectomy catheter. He had many, many other inventions that led to patents. And finally, he established the Thomas Fogarty Institute of Innovation in 2007, which is shown here. Like many of these innovators, he had outside interests, of which most commonly he's known for his vineyard, which is the Thomas Fogarty Vineyard or Winery and Vineyard, which is in Woodside, California, which is where he lives. Well, let's talk a little bit about some forceps and scissors. And I think we'd have to start first with the brothers Mayo, William, and Charles. You can see their dates of birth, and you'll notice that they died the same year. They were, in essence, born during the Civil War and the Reconstruction era, raised during that time in Rochester, Minnesota. Their father was a physician. William got his medical degree from the University of Michigan, same place that Dr. Murray received his medical degree, and Charles received his medical degree from Northwestern in Chicago, and here they are. St. Mary's Hospital, which is now the Mayo Clinic, was opened after a tornado struck Rochester in the late 1800s. William Mayo was chief, and he had his two sons, William and Charles, as medical practitioners. They ultimately took over and opened the Mayo Clinic from St. Mary's in 1919. They rotated, seeing patients in the office one day and then operating the next. As you know, for those of you who either have trained at the Mayo Clinic or have visited, that model exists pretty much today. It's not that dissimilar. William focused more on foregut disease, and interestingly, that's what he would end up partially dying from. And Charles focused more on thyroid disease. Charles, if you remember, was the younger. He died first of a terrible case of pneumonia and died rather quickly. His brother William had actually undergone an abdominal operation approximately 2 months before this unexpected death of his younger brother Charles, and was unable to attend the funeral. 2 months after Charles died, William died. Complications related to an operation on his stomach, foregut. And but those two surgeons are the ones whose name are attached to the Mayo scissors that we use very commonly. The other surgeon that has a name attached to scissors is obviously Myron Metzenbaum. The Metzenbaum scissors are sometimes shortened to the Metz. He was a native Ohioan, graduated from Case Western Reserve, was mentored by George Kreil there at the time, was kind of a gym rat in essence, loved the hospital, loved to be in the hospital. In fact, he was able to get room and board there as long as he would agree to administer anesthesia for free. He created a city-run ambulance service and was very interested in cleft palates and cleft lip repairs. He was extraordinarily ambidextrous. He, in a horse riding accident, broke his right clavicle and operated with his left hand, like there was, and the folks there who were there at the time said they could tell no difference. So he was skillfully ambidextrous. But he had very, very small hands, and he really asked and helped design Metzenbaum scissors because his fingers could fit into them. He could control the scissors a little bit better than he could the standard scissors of the day. Finally, I would say Adson forceps. Alfred Adson was the first section head of neurosurgery at the Mayo Clinic. He was born in Iowa. He made significant contributions to the field of neurosurgery. His mentor at the time at the Mayo Clinic was Emil Beckman, Beckman retractor, you may mention, or you may remember, and had a real passion for neurosurgery. Did the first surgical sympathectomy to treat hypertension and to help manage Raynaud's disease. But as a surgical innovator, Adson was also in need of instruments that would work for him, and he helped design both the laminectomy retractors as well as the Adson forceps. Two tissue clamps that I think we certainly use in thoracic surgery, and I know they're used a lot in general surgery. We'll talk about those inventors and folks who used them. Howard Kelly, I showed you a picture of him earlier with Dr. Halsted, was a pioneer in the field of gynecology. He was a bit of an odd bird in many ways. He, in the midst of his medical education at the University of Pennsylvania, he tired of his studies and decided to go west and stayed out there for a while, kind of realized that he couldn't practice medicine without a license forever, which is what he was doing. And he came back after delivering a baby in Colorado for the first time and decided he really wanted to figure out how to be a better obstetrician. So he completed his training at Penn, stayed on faculty there, and then was shortly recruited 1 year later by William Osler, who was then chief of staff at Hopkins, to head up a newly formed OBGYN department. He was viewed as an expert technical surgeon. Surgeons came from all around to observe his technique and was well respected at Hopkins. He was one of the first individuals, in addition to helping design a Kelly clamp, who advocated for the use of electrocautery in humans. And I think it would be very hard for any of us to do the operations we do today without the use of electrocautery. Wayne Babcock received 2 medical degrees from the College of Physicians and Surgeons in Baltimore and also from the University of Pennsylvania, was also a gynecologist. He is shown here. He was a master anatomist, spent a lot of time in the dissecting laboratory, which is shown here, the dissecting rooms at the University of Pennsylvania. He went on to become chair of surgery at Temple and was chair of surgery for 40 years, which is, in this day and age, almost unheard of. He had many inventions, the acorn-shaped vein stripper. He introduced the use of mesh for hernia repairs and was the first person, along with his colleagues at Temple, to use spinal anesthesia. And also had many important papers in the correct management or the contemporary management at the time of cancer of the rectum and anal canal. So chest wall retractors are 2 that we use a fair amount of, the Finochietto and the Tuffier, Theodore Tuffier, obviously a Frenchman. First pulmonary resection for TB, performed with an extrapleural pneumolysis in 1891. In 1896, along with Dr. Hallian, he published his experiments on the artificial respiration using endotracheal intubation, this time with a cuff around it to prevent leaking. So he's very important in terms of designing the cuff for our ET tubes. He also designed a retractor to access the apex of the chest. It was a difficult area to see through the small incisions. He figured out I need to spread the ribs a little bit, but it was a very small retractor, as the Tuffier is. This was later modified by Dr. Reinhoff at Johns Hopkins, and that modification still pretty much looks like the Tuffier today. I'm not 100% sure, and Dr. Murray can help me out on this, but I believe he was one of the first individuals to do a closed aortic valvotomy as well. The Finochietto retractor, Enrique Finochietto, was a born in Argentina to really Italian immigrants. At 16 years of age, he joined the faculty, School of Medicine. That's how much he was thought of and how accomplished he was already. 4 years later, at age 20, he was then appointed to permanent staff at the hospital. He was an amazing artist, and if you look online at some of his works, they're really quite amazing. With the outbreak of World War II, he traveled to France where he served, ran a hospital in France, and it was at that time, in terms of treating the wounded, came to similar observations that he needed a chest retractor and therefore designed it. He returned from France to Buenos Aires and unfortunately realized at the time that he had contracted syphilis and suffered through much of the rest of his life from the effects of syphilis. But he was very much of a surgical innovator, developing over 67 different instruments, hand drills, the electronically motorized surgical table, many of the things that we use today that we wouldn't attribute to Finochietto were actually some of his original contributions. A couple rib instruments for those of us in thoracic surgery. Eugene Doyen, the Doyen, was really a bacteriologist. He was also a surgeon, a scientist, and probably as much as certainly this generation, and I know my children are interested in movies and the audio-visual stuff, he was probably the first person to bring that forward in surgical history, and I'll talk a little bit about that in a minute. He would often perform operations without getting approval to do so, so patients tended to do very well, but he wasn't viewed well by the establishment in France, and he very much challenged the standard practice of the day. He had a number of different inventions, including black and white films, which he filmed of his patients getting surgery. And this was an anathema to a very stoic French academic surgical society. They were shown on the side, if you will, in kind of tucked away places in Paris. But they were readily embraced by the Americans and was one of the ways that he contributed to the education of American surgeons. Here he is shown demonstrating his bipolar coagulation device on the left, and on the right is the Doyen room that contains more electrical devices and research in terms of what he was interested in. I thought we would end up with two University of Michigan individuals, John Alexander and Cameron Haight. John Alexander served again in World War I after completing his medical degree at Penn in 1916. Following the war, he took a position at the University of Michigan. He contracted spinal TB and spent a fair amount of time at the Lake Saranac Sanatorium. And importantly, and I think as a nod to Dr. Murray and his interest in resident education and curriculum development, Dr. Alexander is credited with developing the first formal thoracic surgery education program at the University of Michigan. Dr. Haight was a mentee of Dr. Alexander. He excelled in the diagnosis, classification, and subsequent treatment of children with tracheoesophageal fistula. One of the earliest successful pneumonectomies was actually performed by Dr. Haight as well. He was the son of a San Francisco physician, graduated from Harvard Medical School, and left Harvard and went to Michigan, where he trained under Dr. Alexander. And he also was an important innovator and very important in the surgery residency program at the University of Michigan. So in conclusion, I would say that some of the instruments that I use today, certainly used throughout my residency, were from the subspecialties. Neurosurgery was Adson, gynecology, Kelly, Babcock, otolaryngology, Metzenbaum, ophthalmologist, Castroviejo, needle drivers, and a lot of pioneers who came out of the United States, DeBakey, Cooley, Crawford, all from Texas. If you can't remember all this, like I can't, I finally decided we ought to write a manuscript on it, and you're welcome to look this up, but much of what I discussed today is in that manuscript. I had 2 final pictures. This is when I left West Virginia. I did my thoracic surgery residency at the University of North Carolina of Chapel Hill, where I had another wonderful mentor, Ben Wilcox. Ben and Gordon were partners at Chapel Hill before Gordon came to Morgantown. And Ben, unfortunately, died, I guess, 2 or maybe even 3 years ago. And but this was a picture that, again, in preparing for this lecture, I came across, and it brought back a lot of fond memories for me. But it's been a pleasure and really an honor to come back home to West Virginia and to honor Gordon Murray in this lectureship. And I again want to thank Dr. Murray and all of the Department of Surgery faculty, Don, and West Virginia for the opportunity to be here today. So thank you.
What a wonderful review of surgical history, and all of us are fans who have worked and know Dr. Wilcox and Dr. Murray, and have gotten to know Dr. Jones. We all admire all your work. Dr. Murray, do you have any questions or comments? Do you want to step up to the lectern and give us your opinion?
Well, thank you, Don. David, I don't think you should have mentioned that 1963 date, because I think I was a second-year resident. Well, I mean, I think everyone in the room knows how proud I am of David and what he's accomplished. It's just thrilling to see what you've done, and appreciate very much you coming out a day early to give this lectureship. I'm very, very honored to be the recipient of this lectureship. I also want to express my appreciation to Dean Ross for his efforts to revitalize the lectureship and allow me to come back to West Virginia in the Department of Surgery. And Don, I also appreciate your strong support in the recent weeks. I think I'll end at that.
Thank you, Dr. Murray. If you can stay up here, Dr. Murray. Dr. Murray, if you can stay up here, we have a special presentation. If Mrs. Murray and your daughter can step up, we've got a task for them. As part of the traditions, the new traditions of the Department of Surgery, we want to honor the old traditions of the Department of Surgery. And we want to unveil the first of what we hope will be a series of portraits that will hang proudly outside of the department offices on the 7th floor. We plan to have a row of portraits of all the former chairs and honored clinicians of the department. And we are especially honored to have this occasion, the Gordon Murray Lecture, to to show you your likeness. Mrs. Murray and daughter.
And I certainly appreciate this very much, and I think that my family and the family that's not here will be very, very proud of having that picture on the wall. As many of you know, our oldest son has his picture in the School of Public Health over at the Dean's office, and so we got two Murrays. What I was sort of overwhelmed at the end of my last comments was that I wanted to say and didn't, but I really do appreciate all of you coming out. It's just, it's really special to see everybody, and I'm looking forward. I haven't had a chance to talk with everybody yet, but I'm looking forward to it at the reception here coming up shortly. And again, it's been a very, very wonderful event for me and our family, and I thank you all.
That's a picture. Linda Schaefer will be taking some pictures, and then you guys, everyone here can come up and admire the portrait, and we're going to have a reception at the pylons area, right? A reception at the pylons area where you can meet and chat with all your former colleagues, meet and chat with Dr. Jones and Dr. Murray, and we'll see you there. Thank you very much for coming, and we'll see you tomorrow for sure.